In the TF.
Jojo.
Hoi. Today comes another therapy topic. Mental health therapy.
Yeah, mental health therapy. We're going to be discussing about it.
Mental health therapy. Woo! Best topic ever.
Yeah.
How fortunate. Oh yeah, but trust me on this. You don't really need to be sick to join in for mental health therapy. It's a matter of finding the right person to talk to, or at least a professional that can help guide you during complex emotions, especially. Yeah, because as humans, emotions are incredibly difficult at times, and you don't need me to remind you how that can be. So, let's start, somewhere. When should I go to mental health therapy? I went to mental health therapy when I had my first breakup.
Yeah, I remember.
Yeah. And boy, was that hard. It wasn't so much that I couldn't let go, but it was more so I don't know what I was feeling. And hence the complex emotional situation that I was in, and I need to decipher it. And knowing myself, I was like, I want to be efficient. I want to get this out fast.
That's like a typical T thing to do.
Yeah, I'm like, I know I am sad. I want to understand why. I want to do it fast. I go to a professional.
Then that's me, the one who's like, I need time to understand.
I will sit at my corner and think.
I'm the kind.
I am DJ go zoom zoom. I am speed.
Efficiency.
I settled it in 1-1 and I feel so much better. Yay!
Yeah, then...
But that really depends on your personal outcome as well, because it's like how if you're a smoker and the doctor tells you need to stop smoking, and if you're not very cooperative, you don't take your meds, then of course you're not gonna feel fast.
Yeah.
So it's kind of the same thing. They don't prescribe me meds because they're not it's not the psychiatry. I went for a licensed psychology therapist. Yeah. So they only prescribe me emotional therapeutics.
Oh.
Yeah, so they just guide me how to analyze it, and I did a lot of reading on my own as well. So that's why I could, I guess, recover in 1 month time. It was 1 to 2 months. 1 month was the major recovery, and 2 to 3 months was the latency period.
Yeah.
But yeah, during complex emotional needs, it's a good time if you like the mental health therapist to help out. It could be a mental health consultant, it could be a psychologist, it could be a psychiatrist.
Yeah.
These are good people, but of course you need to do your own research on who are some people that you would like to have this conversation with, because things are highly personal, highly confidential, and not all therapists are the same. They could achieve different results because of their methods. And so it's not easy for me to say, oh, this style must go to this therapist, but it's more so who do you trust, and of course there's
who
some who can be trusted. You have to see their reputation as well.
Yeah.
So also check out for which institute they came from, what kind of licensing do they have, are they a solo practice or is it a associate's practice? Yeah, are they practicing under a mentor, or are they practicing under academia? Like if it's a university setting or it's a private practice, those sort of stuff. Yeah. So those are some info you like to get beforehand. See what they specialize in. Some specialize in what's this called? Environmental change. Environment change, not environmental change. That's a different thing on its own. Environment change, where you have you suddenly move to another country and you're feeling culture shock. There are leadership problems, or work communication, couples therapy, personal therapy, trauma, behavioral therapy, cognitive therapy, and it goes on. So you kind of need to, read up a little bit, see which one kind of suits best for your situation. And always know that the first session of therapy is most likely just you getting to know your therapist and the therapist trying to get to know you. And so during the first session, do not expect too much to go on.
Yeah.
So during the first session, you kind of figure out if that therapist is suitable for you. Let's just kind of talk a little bit, see if the vibe clicks. So it's kind of like a date, just that you're finding the right therapist instead of finding someone to marry. And
Okay.
speaking of this, it's very important to make a very clear distinction between you and your therapist.
Oh,
It's just
yeah.
like you and your doctor should not be overly close.
Yeah.
Yeah. So similarly, you don't want to be overly attached to your therapist, and the therapist should not be overly attached to you. The therapist is purely professional to consult your emotions or your mentality at the time.
Mm.
Yeah, and that's all they are. So do not confuse them as anyone else. If you do cross that line, then they are they are no longer a super candidate to be your therapist in the future.
At least like from a logical point of view, because you need someone unbiased
Yes.
to actually, but at least that's what I think. You need someone unbiased to actually help you, guide you through all these, So yeah, which is one thing that I wanted to say about just now, the trust. I have heard from my mom a lot of all these secondary school counselors. They run off telling people what the students told them, which is such a, I don't know, I would be so angry if someone does that. So it's like really important to actually get a proper therapist that you trust and can be trusted, because it's really, I don't know what's going on with those teachers.
Right.
Like, why do you actually? But I'm so triggered when I hear stories of like people saying, "Oh, I went to my school counselor, and then after that, she went and spread the story to my class teachers and whatsoever." Like, why? And okay, honestly, even if people tell you, like, "Oh, your student, the student in your class has this problem," doesn't mean that you should openly talk about it to them. Like, just pretend like you don't know. It's just like how when you go to a therapist, you don't want them to be going around telling things people. It's annoying. So yeah, it's important for you to like find a therapist that you trust and can be trusted, and at the same time is unbiased, and they are able to give you insights of the logical part of things and emotional. I mean, I not to say I'm a therapist, but I've come upon like a lot of people who comes to me to get advice or rent or whatsoever. So yeah, I kind of understand like the idea of it.
Oh yeah.
Mm.
And mental health therapy takes time.
Oh yeah, definitely.
I am the example of the one that happened to had it over quickly because I had too much logical things
Yeah.
going on. I'm like, I can't be more bothered. I just want to get this over with.
Mm.
My body just wants to react like this, so I'm gonna fight it. That's more or less me. But it doesn't have to be like that for everyone.
Oh, I'm not like
Oh yeah, for sure.
that.
And of course, there are pros and cons to it, where you kind of want to take it at a reasonable and comfortable pace, because if you finish it up too fast, then you end up with the emptiness of, was I healed properly, or the guilt, or how do you say,
Getting over things.
not to say getting over things, but you are
You feel like you're moving too fast.
things are not tied up properly. The knots are not tied well, There is the chance of that happening
something bothering you.
Yeah, it ends
some
up
way.
bothering you,
Mm.
or that you didn't actually heal up properly. You were
Mm,
skipping some steps in between. Or
mm,
maybe it could be both sides. It could be the therapist trying to go too fast, or if you feel as if you are fine and the therapist was trying to help you, and you just say, no, 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 I'm fine. Then the therapist can do nothing but, okay, then
yeah.
there you go.
So
Yeah, so you gotta know that fast doesn't mean it's good,
yeah.
and that you gotta digest at times, because therapists are not a one-stop solution.
Oh,
They are
definitely.
just there to guide you to better understand your emotions, and they have the professional tools to help you overcome certain fear or trauma, or to better understand yourself as a person.
Mm,
And in the end, it all goes through you. They are just providing you the tools and the knowledge to do so.
yeah.
You can you might want to check out prices as well, because not
Oh
all
yeah.
therapists are the same.
That's one thing too.
Yeah, some therapists charge more, some lesser.
Mm,
Yeah, some offer charity. So even if you're not going for therapy, always it'll be good to help out those who are more in need. Plus, it's
mm,
charity, so it's good stuff.
yeah. For the better.
For the better, and that's really what I can say for now.
Mm-hmm.
Yeah, maybe I'm too logical in this, but that's the most important part about going to mental health therapy.
Mm.
You can go to multiple at times as well, but
Oh
I'd
yeah.
recommend going to at maximum 2 therapists,
Mm.
because they could be, especially if they specialize in different fields.
Sometimes the route is more than one.
Yeah, there's
So
more than one route, so it is good to approach 2 separate therapists for 2 separate problems. Do not combine any of those problems. So what I had at my time was, I went to 2 separate therapists. One was more cognitive, and
okay.
one was more trauma.
I see.
Yes.
Okay.
So maybe that kind of helped me sped up, because I solved
Both.
2 problems simultaneously in some
Yeah.
sense. Because of course they are intertwined, but at least I found the root causes of both.
Yeah, I think that's the most important part. Looking for the root of it.
Finding the root of it is incredibly important, but I only advise at maximum 2 therapists at a time.
Mm.
Because anything more, then you end up like having a lecture where you have lecturers telling you what to do, and you gotta figure out all your homework.
Yeah. Or like sometimes you forgot whether you have told that therapist something
or not. Yeah.
not. When you have told other people, it's like, I feel like I've told you before, but it's actually another person. So, that's like
You get
that
lost.
mix up. Yeah. So, yeah, that's good insight.
Yeah, but these are insights as a beginner, and maybe that you guys could suggest more questions when it comes to therapy that I didn't bring up at this time, or if you're looking into therapy, or if you're looking for a therapist or someone else.
I feel like this is more to like you're still functional in a way. It's not like a mental disease yet.
Maybe typically you may not be keen to look for one, especially if you don't feel like you are diagnosed with a certain mental disorder.
Of course.
But this is always good for functionality purpose.
Yeah, that's why this is more to like, functionality purpose instead of like when you have a mental disease. If you have a mental disease, you really have to like look into things, get really professional advice instead of just, just like it's not like a short-term thing. Unlike, some of us, we just happen to be in that period of time, so for that period of time we need them.
Just to go through it.
Yeah, just to go through it. So if you actually do have like mental health problems, do seek professional help. And in the meantime, stay healthy.
Yeah, stay healthy is a good one.
Yeah, stay healthy and stay happy. I mean, try to stay happy. Anyways.
You will be happy.
Anyways, India,
we judge.